So let's talk about Medicaid. Medicaid is a joint federal and state program designed to provide health care coverage for individuals with limited income or resources. So, unlike Medicare, Medicaid rule can vary from state to state because states help manage and fund the program itself alongside the federal government. So, you're going to hear us talk about Medicaid, especially on this podcast, the majority of the time because we're talking about specific states. So it's really hard for somebody like me in this situation. I'm talking to a lot of you that are from so many different states, so many different backgrounds. It's hard for me to generalize something like Medicaid that is so broad between its different states. So then that could be what services are provided. It can talk about how the legislator kind of works with Medicaid, what department handles it, anything and everything, it differs across the board. So I'm going to try to generalize it for you guys and help you understand just what it is in general. And then over time, a few more of these podcasts, we could actually get more in depth on different states and how they handle Medicaid. So, Medicaid covers a wide range of healthcare services, but one of the biggest differences is Medicaid is the primary payer for long term care services in America. So, primary, they are at the top. These are the ones you're going to hear about. You're going to hear about Medicaid paying for these things. So, that includes home and community based services, also HCBS, you hear it either or, same thing. Private duty nursing care, personal care services, long term support for children and adults with disabilities and nursing home care. For many medically fragile children, seniors, individuals living with disabilities, Medicaid is what allows them to remain safely at home. So, broad range. We're not just talking about the 65 plus population. We're not just talking about individuals that are in the hospital or need care after a major surgery. Medicaid is covering a broad range of individuals that need care, especially that long-term care. That's key. So the biggest thing I think of when I think of the difference between Medicare and Medicaid. Medicare, federal, short-term, Medicaid, state and federal. I don't want to just say state because the federal government does pay for some of Medicaid, but I just try to keep it as more on the state level and long-term care. So I hope that's helpful for some of you. I know that could be confusing. So let's talk about the biggest difference between the two.